Hello everyone and welcome to this session. This is a final session on resources for health in which we look at solutions to human resource challenges. Let's start off with a question. What strategies are you aware of that have been put in place to address the human resources for health crisis in South Africa? To answer this question, think back to the different health administrations over the last 25 years. Are there differences between the strategies implemented by different health ministers? Can you think of specific strategies that might have been put in place to address human resource challenges? Perhaps you can think of general policies that have been developed to improve the health system that could have had an impact on human resources. Here you can see a timeline that details the different strategies put in place across different health administrations in South Africa. You can see from 1994, when Nkosazana Dlamini-Zuma was our health minister, that there were already a number of policy directives that were being put in place and a lot of legislative changes. In fact, the first strategic plans were only drafted in the year 2002. We see here the PIC report, and later in 2006, the second National HRH strategy. What is interesting about this is the interrelationship between general policies to address health problems within the health system in South Africa that had a direct bearing on human resources for health, as well as a number of legislative changes that would have impacted human resources directly or indirectly. But specifically, we can see that there are quite a lot of health interventions aimed at human resources for health. These are the orange blocks that have been put in place over different periods in time. You can see the continuation of this timeline until the present, with the addition of reviews or evaluations around how effective some of these interventions have been. In 2012, we see the third National Human Resources for Health strategy, which is the strategy we currently sit with. In 2006, the World Health Report by the WHO focused on human resources for health. What this report presents is a framework that is useful to think about strategies that can be put in place to address some of the main human resources challenges. In this framework, we see that they consider the point of entry into the workforce, how we should support workers while they are working in the workforce, and also the point of exit. The ultimate goal here is to improve workforce performance. You can see the 4 measures of workforce performance are what we discussed in last week's lecture: availability, competence, responsiveness, and productivity. In this lecture, we are going to look at each of these points and discuss some of the solutions that are put in place. The first phase in the Human Resources for Health Strategic Workforce strategy is the entry phase. This phase entails preparing the potential health workforce through education and training. This is a stage where health worker cadres are produced and is supported by investments in education and training, workforce planning, providing support and management of the recruitment, education, and training of programs. The education and training programs can be supported through building strong institutions, ensuring access to good quality education, and establishing strong recruitment strategies. Some of the solutions that come out of this phase focus specifically on education. It's important to build more and stronger institutions for training different levels of healthcare workers. It's important also to support the people who are training our future healthcare professionals. We have to think about supporting teaching staff to remain current and responsive to the changing needs of the population. We have to provide career incentives for people working within higher education so that they stay there. If we think about it this way, we need people with experience as doctors or nurses to be training future doctors and nurses. If they can earn more money as a doctor working in a private sector, for example, they might choose to stay there rather than to work in education. We have to assure that educational quality is maintained and regulated through regulatory bodies. There's a role here for stewardship. In other words, we have to think about organizations that take a specific role focusing on the quality of education and ensuring that that quality is maintained. We can see that also that there needs to be a focus on recruitment of newly trained healthcare workers to ensure that once people have finished their training, that there are places for them within the health workforce. In South Africa, one of the strategies that has been put in place is to train more mid-level health workers, such as clinical associates. The reason for this is that it takes much quicker to train a clinical associate who has a high level of skill that can work between different cadres. So somebody like a clinical associate can work directly with a nurse and with a doctor in a district hospital. It's important that we support low-level workers in developing countries such as South Africa. Here, for example, we can focus specifically on community health workers who play a very strong role in linking communities with health services. Importantly, too, is to reorient education, research, and service priorities to respond to current and future needs of changing societies. The COVID-19 pandemic, for example, is a very good situation in which our education system has to rapidly adapt in order to prepare and change in the light of pandemic situations. Once people are in the workforce, we have to make sure that we can keep them there. So after health workers have been trained, they enter into the workforce phase, which is the second phase of the strategic plan. The strategic purpose of this phase is to ensure that the working environment and performance of workers is well managed, and that it is maintained in order to support the professional development of health workers so that they may constantly learn and improve. Also, we see that the focus is drawn to creating suitable environments in order to retain professionals and to avoid problems such as attrition, which is loss of healthcare workers, and migration out of the country or out of the health sector. This stage is the Human Resources for Health strategy that focuses on good, fair, and competent, supportive, and motivational environments through supervision, fair compensation, and opportunities for growth and development. So we can see a very important aspect of the workforce solution stage is to focus on supervision within the health workforce. We know that continuous supervision, specifically for young doctors, makes a difference in keeping them within the health workforce. It's very important that health workers are fairly and reliably compensated. In South Africa, for example, we have implemented a strategy called occupation-specific dispensation to make sure that there are not massive differences between public and private healthcare in terms of what one will get paid. We also see it's important to have clinical support systems put in place. These systems will ensure that people can continue with lifelong learning. It's important for healthcare workers to continually adapt and change their knowledge as the health circumstances of the population shift and change, and as new technologies emerge. Improving the health workforce is one way to make the work environment more desirable. There are many ways in which we can do this, for example, by focusing on the safety of healthcare workers. It's also important to manage how healthcare workers work. If we have people working in the public sector who also want to run a private practice, we have to manage that work to ensure that people are not moonlighting. The issue of RWOPs and moonlighting will be discussed in session 5 this week. What's important is that we build competent management to support our health system and to support the health workforce. The final phase in this strategy is exit out of the workforce. In this phase, measures are taken to manage migration and attrition, and to reduce the loss of human resources. This can be achieved by improving work conditions, by creating an accommodative environment for all, by ensuring a safe environment, and by having a retirement plan for aging people within the health workforce, which can reduce the risk and rate of attrition. Managing migration is a complex balancing act between people's individual freedoms and choices to move where they want to, and making sure that we do not deplete one health workforce for the advantage of another. Where rich countries are likely to recruit from poorer countries, we need to make sure that fair and just recruitment policies are put in place. One way of sharing the migration experience between two different countries is through bilateral agreements. It's important also to keep health work as a career option for women and to make workspaces suitable to women's needs. If we are going to train many health workers who are women, which is the case in South Africa, we have to be aware that women take on different types of work within their personal lives. They might have children, they might have families to manage, and in these cases we have to make sure that women are still able to work and to fulfill their other duties to society. One suggestion to make the health workplace more accommodative is to offer flexible hours specifically for pregnant women or women with children. We have to ensure that the workplace is safe and people are not exposed to unnecessary dangers. How do we do this? We can focus on minimizing occupational hazards. In South Africa, for example, where we see HIV is a huge problem, we have to make sure that the health workforce does not feel that they are at risk of contracting HIV through the work that they do. Similarly, by providing protective equipment to the health workforce during a pandemic, we can try and prevent as much as possible the chance that the health workforce will be affected by the nature of COVID-19. When it comes to retirement, it's important that we have planning put in place through policies that reduce incentives specifically for early retirement, so we can keep people in the health workforce for as long as they are willing and productive. We can also look at recruiting people who have already retired. In South Africa, we find that a huge number of nurses, for example, are over the age of 50. Yet they are still very valuable because they have institutional knowledge that can help in supporting younger staff. So we could bring these health workers in different capacities to support young and new staff in the health system. Very importantly, we have to ensure that there is succession planning and career pathing for people within the health workforce, so that they feel that their careers are going somewhere and that they are supported by the health environment itself. To wrap up this presentation, let's use an example from the South African context in terms of how the strategic framework can be applied. Let's think about rural health in South Africa. How do we get people to work where we need them the most? From the entry perspective, we can think about planning, education, and recruitment. Our curriculum should focus more strongly on rural medicine and primary healthcare to give future healthcare workers more exposure to rural contexts. By increasing the number of students that come from rural or diverse backgrounds, we find that people are more likely to return to the areas that they come from. It's very important that students, as well as people working in rural areas, have a positive experience working in those settings. So when we think about the workforce aspects around supervision, compensation, and system support, if we improve the supervision of people in rural areas, they are more likely to have a positive experience. In South Africa, we have set a rural health allowance to encourage people to work in those contexts because they will earn a little bit more money. Finally, when we think about career aspects around the exit issues, we see that in South Africa there are specific residency programs for rural training, which gives people opportunities to further their studies and specializations in rural contexts. This is going to encourage people to work there for a longer period of time. Ultimately, what we're trying to do is to improve our workforce performance. We need to ensure that there is a strong availability of healthcare workers, that those healthcare workers are well trained and are competent to meet the needs of the population, that the health system itself is responsive to the needs of the health workforce, but also responsive to the needs of the population, and that the health system is productive by being effective and efficient in achieving improved health outcomes.